Hi, I'm Dr. Jane, and many of you would know me as your GP. I'm going to talk to you today about healthcare homes. This is a new program that we are offering at Don Medical Clinic. Healthcare Homes is a pilot project that is a federally funded national project that 179 practices are currently signed up for. The goal of this program is to look at alternative funding models in primary care and to achieve the quadruple aim. The quadruple aim involves the enhancement of patient experience. That is your experience in the primary care system, as well as improving the population health overall in our communities, both statewide and nationally, to reduce the cost of healthcare because there is a great deal of duplication due to poor communication, and to improve the work life of healthcare providers because there's not many of us, but there is an increasing demand within the community for healthcare. We currently offer the Keep Well Clinic, and many of you who have been asked to consider the healthcare home model have also been seeing us through the Keep Well Clinic. This would have been through a health assessment or a GP management plan. The care would remain the same. It will still be called the Keep Well Clinic, but we'll have different ways of funding this program and funding the healthcare that we give to you. Currently, we have the Medicare funding model. This is a fee-for-service model. It is item number focused and it's quite inflexible. For every item number, you must see the doctor. There are some nurse-specific item numbers, but not very many. Healthcare homes is different in that if you are eligible and you do meet the criteria, we are provided with a bundled payment for 12 months to provide your healthcare from our practice. That way it can be flexible, and the amount per bundle is dependent on what tier you are classified as. We have used a practice tool to identify patients in our practice with chronic disease who might be eligible for this program, and you are one of those. To assess which tier, we use another questionnaire called the HARP tool to do this. A nurse and doctor will guide you through this process. Once your eligibility is determined, then you are allocated a doctor, who at the moment, that is me. Until we're convinced that this is a well-funded or adequately funded program, it will be me and my patients on this journey. The program is very much redefining and making us revisit what is patient-centred care and collaborative care. And one of the key goals of this program is to really help you identify what your needs are and to be able to deliver those to you. We're going to use a Promise 10 questionnaire on a 3 to 6 monthly basis that we'll ask you to complete, that will look at areas of your mental and physical health, and improvement in those areas will help us identify whether we are meeting your goals. If you're interested, then please reply to this email and one of our staff members will contact you. Or you may have been asked to watch this video before you come and see me in your consultation, and we'll revisit some of this again as we can talk a little bit more about that. If you're still interested after all of that process, then we need to ensure that you have signed a consent form to sign up to this program, that you have completed a health questionnaire that will help you and us identify what are realistic goals for you. We will use the HARP tier tool to see what tier you are. We will register you then with Healthcare Homes. You must have a My Health record and you must consent to a summary being uploaded into that. We will also establish an online shared health summary that you can access and any of your healthcare providers that you nominate can access. For younger people, this may be the school, teacher, principal or psychologist, depending on whom you consent to. This summary must be reviewed every 3 to 6 months, depending on which tier you are classified as. It must encompass an annual health assessment, which I think is one of the most fantastic components of this program, and the 6 monthly Promise 10 survey. Once you're signed up, though, you may well be contacted by the National Healthcare Homes team to provide feedback on your experience with the program. It's important information for the team to gather, and they'll also gather information from us as we put all of this data together to see whether this is a program that can be rolled out nationally. Will your current care change? No. Don Medical Clinic works really hard to offer quality, accessible, affordable, confidential and non-judgmental healthcare that's consistent and collaborative, both within and outside the practice. I try to make it timely, but the limited manpower and the demands on our system make that difficult. I'm hoping that Healthcare Homes will help me achieve that more so by allowing me to use other members of my team, especially my nurse, and our reception team, one of whom is training herself to become a medical practice assistant. This program therefore allows us as a practice and a team to be paid for many of the jobs that we are actually already offering you, which is email, texting, telephone calls, scripts and referral letters, as we follow up and support your ongoing care. For more information, please contact the clinic using the email keepwell@donmedical.com.au or phoning the practice during business hours. I really hope that you will join us on this journey. I think it's really exciting for us as our little practice in regional Devonport to be able to have a voice and contribute to the changing of the National Healthcare Program, because the current program is dated and you would have to agree. Thank you for your time. Bye.